Good afternoon, everybody, and thank you for joining us. We are starting out on the first of hopefully a series of videos where we're going to be talking about some subjects that are important to Canadians concerning our health. And I am very privileged today to have with us Dr. Karpakis, who's a physician here in PEI. Welcome, Janine. How are you today?
Thank you for having me. I'm doing well.
How are you?
Thank
Yeah, you're doing well.
Yeah.
You've been a physician for how long now?
It's actually been a complete 32 years. Quickly going to be 33. Yeah.
33 years. Wow, that's remarkable. And you've practiced medicine in a number of provinces in Canada, haven't you?
Yes, I have. I've had that privilege too. Yeah. Many systems all over the world, really. And it's wonderful because then you can enrich yourself and give back to the community with all the lessons you've learned. Yeah.
And how are you enjoying PEI?
Oh, what's not to enjoy? It's so beautiful here. And all the emerald green and the ocean blue in the summer. Beautiful people.
That's true. That's true. So what I'm hoping to do is take 10 minutes of our time and just talk a little bit about the Understand My Health program from PEIDoctor that we're coming out with. So let's ask a common question that I run into often as I speak with friends and family and people in the community, and that's essentially I've seen my doctor, or I've seen many doctors in some instances, even specialists, and I still don't know what's going on. I don't understand the information that's been given to me. Why does this happen?
Well, if you think about it, most physicians like myself, doing this for 33 years, I started medical school straight out of high school. Yeah. So I only see life through the lens of a physician. The words that I'm used to using are physician language, medical textbook languages. So, so many decades in, this is the language I know, and I'm not aware that I'm using words that perhaps people that are not in the medical field know. And then also, unfortunately, with the busyness of modern day living and the strive towards efficiency, we're always, as family physicians specifically, and even my specialist colleagues, we just don't have the time within the time allotted in the system that needs to allow the volume of patients to sit down and really ensure that communication and connections.
And I presume that must be quite frustrating sometimes for doctors as well.
Yeah.
The time constraints. Yeah, certainly from patients we're hearing that, or individuals we're hearing, I wish I could just get more time, right? And what kind of things do patients typically want more explanation about in your experience?
Well, a variety of things. So I think it depends on the context and where you are. I think a very common occurrence is like lab results and diagnostic imaging. People will bring the report to me and say, I just don't understand this, or this word is scary. When I Google it, it means, that this is a cancer. Is this true? Why didn't my doctor tell me what to do about it?
Right.
Yeah. And those are really important things. It takes away quality of life, if you don't know what it is. Yeah.
And I think there's a lot of anxiety sometimes with in some families, and even caretakers, adult children having to take care of their parents, elderly parents, and running into some serious diagnostic or health issue. And I think so many of us turn to the internet, right? Trying to find answers, and sometimes that's even more confusing. But let's take a practical example. For example, just a MRI report. You look at it and you look at the information. So how could one of our Clarity Understand My Health sessions help with just something practical as that?
Yeah, so like I said, I have a recent example. A very good close friend of mine called me yesterday and said she's got this word that sounds like it's a sarcoma on her MRI. And does that mean that, the end is near? And why didn't the doctor talk to her about it? And completely distraught. And then fortunately, I could walk her through that. And we got to the point where I could completely reassure her because there was no risk for this to become malignant. It just sounded scary. Other things, that I very often get asked about is chest x-rays. What does hyperinflation mean? Why wasn't this explain to me what is it that I can do to prevent perhaps that my x-ray becomes like my mother's x-ray or my father's x-ray. And then we can even branch off into sort of genetic risks and things like that. Because these genetic reports are, in my nerdy scientific point of view, awesome, but they need interpretation.
That's right. And I imagine cancer diagnosis can be particularly frightening for many individuals and families as well. Being in a family, we experienced that firsthand. I recall how anxious I was personally seeing a loved one go through something like that. So how can one of our sessions, for example, potentially help a family or a person who's been to the doctors, have a diagnosis of cancer, and now what?
Yeah. So it's actually multifaceted how our sessions can help. So the first thing I think that sort of an elephant in the room, but no one speaks about it. So the patient has extreme discomfort with something that seems dire.
Yeah.
The physician who's needing to give the information and the message to the patient is also extremely uncomfortable. And many physicians aren't that experienced or willing to be vulnerable or have those difficult conversations with patients. And we all need that. We all know that it takes time, and we don't have the time. Yeah. So it's sort of a rush job, and then run, for the hills, and the poor patient is left there, and everyone's unhappy. So the first thing is time, and also to have the time with a physician who's comfortable to sit down, be honest, and have a difficult conversation. So that's the first way we can help. Secondly, very important is this is not a diagnostic session. It is not a therapeutic session. It's advice. So, with that, we can help with diet, lifestyle, what to do in the future, how do I protect my children, who would be the best person to approach if you don't have a provider yet. That's extremely important things, and very often can even be life-saving.
Yeah.
You can see I get passionate about it.
No, I can see that, and that's why we're so grateful that you're part of our initiative. The other issue a lot of people face is seeing multiple physicians and specialists and getting a whole bunch of different information and trying to figure out now what's important and what's not with all these reports. Is that a common thing you think?
Yes, even in my own experience, when I'm the patient and the chairs or the tables are turned, it's also incredibly difficult because although the whole system is striving towards integrated care, because everyone wants to be efficient, it's siloed because you need time to integrate. So, the cardiologist can't speak to the nephrologist can't speak to the oncologist, and so forth. And it used to be that the family physician would be somewhat of a navigator, but that is becoming more and more scarce.
Right.
And again, all of us are chased for time. And the system is working against that. So it would be good for everyone to have access to what we're hoping to give them. is a sit-down session with an experienced physician who's able to ensure that that person or family member or loved one knows and understands what they're anxious about, and what to do about it.
I think that's valuable, and do you think after a session or a few sessions such as this, that what difference would it potentially make to some patients or some individuals having anxiety or struggling? What do you hear when you have these conversations with people, after you've had these conversations or sit downs with people?
Look, it's life-changing. It's life-saving often. Because, our wellness journey is not just the physical body. It's not just a tablet or infusion that you get. We're a mind, body, soul. And when you know and your knowledge is your power, you can harness that in the mind, body, and soul. And that patient will have a much more positive journey towards their healthcare recovery than someone who doesn't.
Yeah. And it's interesting because we are kind of bringing a new program or new offering to the community. So let's just talk a little bit about what we are not offering, what the service is not about.
There has been some confusion about this because I think it's so new and people don't have a reference point. So what we are not offering are things that will be contravening the Canadian Health Act. I know my colleagues keep this completely separate, and we never want to contravene that or be a cause for that to disappear. So what we're not offering is diagnostic techniques, procedures, anything like that. So that means you're not going to get a lab requisition. You're not going to